Hi, my name is Zach Eastburn, and I am a patient advocate with the Center for Patient Partnerships. The Center for Patient Partnerships was founded in 2000 by law professor Meg Gaines. Meg herself is a cancer survivor who used her own experiences with the healthcare system to realize a vision for patient-centered advocacy. Her dreams coalesced in the founding of an interdisciplinary center that draws on students from the schools of law, medicine, pharmacy, nursing, clinical psychology, and public health. In its nearly 15 years, the center has been recognized by the YWCA, the Komen Foundation, the American Cancer Society, and many others. To this day, the center operates out of the University of Wisconsin to further its mission, which is to engender effective partnerships among people seeking healthcare, those providing healthcare, and people making policy choices that guide the healthcare system through education, advocacy, research, and policy. We work with patients with chronic medical conditions, life-threatening illnesses, and insurance issues. Our work can involve appealing insurance denials and helping patients understand their illnesses, but being a patient advocate can be so much more.
My name is Corey Trott. I grew up in Wilmington, Delaware. I did my undergraduate degree in GW in DC and my graduate work at Drexel in Philadelphia. It varies on what your client's needs are, and I think that for me it means listening and then making calls on behalf of a client who's having a difficult time navigating a complex health system, whether it's an insurance appeal, just helping them understand that process, or a client looking to find a care provider, helping them navigate what possibly good options are, or maybe less good options are, and making sure that whatever you find is in line with what they want and their needs. I think the most important skill I've learned this summer is active listening, and I think for me that's been the most rewarding as well. Having clients in situations where there really is no good outcome sometimes, just listening to their story and knowing how helpful that can be for them to just tell someone what they're going through. I had one client who had an insurance appeal to get pre-approval for a surgery. She was feeling a little overwhelmed, so I helped her organize her thoughts about her appeal, but in the end she won, and I felt like I hadn't done a great amount. But she was just so grateful that she was able to have someone to talk to and to bounce ideas off of. And we ended up saving her $8,000 because her insurance covered her surgery.
My name is Abigail Navarro. I'm a second-year medical student here at the University of Wisconsin School of Medicine and Public Health. My background, my BA was in Spanish, and after doing a bachelor's degree in Spanish, I also lived on the south side of Milwaukee and got to really know my neighbors, a lot of whom were Spanish speaking, and learned of their hard work and their struggles, and that got me really interested in working with more people who are Spanish speaking in the US. Here at the Center for Patient Partnerships, I worked with a Spanish speaking family from Ecuador. The woman who came in to see us, her name was Carmen. When I first met her, I sat down and used the skills that I learned from the center, which were deep listening, and I let her talk as much as she wanted and was able to really get a really deep background about what she's been through and what she's currently struggling with. And I feel like if I hadn't done that deep listening, that I wouldn't have learned so much about her.
My name is Carmen Kumbajin. I'm the mom of Leilani.
My name is Jose Byron Yang Zapanta. I'm the father of Leilani. We have a lot of problems, but I think about my family, about my situation, because my daughter, she have leukemia.
When I first met Carmen, she was in the hospital with her daughter. Her daughter had just been readmitted because she was suffering from a virus because of a bone marrow transplant that she had had.
It's hard, for us because before we don't have problems, we work, we never in this situation. The first year we say, I very shy, I say, no, I don't need help. And here the hospital too is the best. They all time say, you okay, the nurse, the doctor, the social work time answer to us, the guys need something, the guys okay. We say yes, 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 but now it's 3 years.
More than 3 years.
More than 3 years now, the situation is very, the little money we have, everything is gone.
The family's financial and emotional stress levels are very high, and so Carmen came into the center originally and met with our supervisors, and she was asking for help paying for a new mattress because her mattress had been ruined due to her daughter's side effects from chemotherapy.
You know, now I have the teacher Abigail, the student Abigail, and she say, "Where are you, Carmen?" I say, "Maybe in the hospital." "Oh, I live close there," and she walk. "Oh, it's the night." She no look nothing. She just try help any person, any family.
Originally, after we found out what Carmen was in need of, we first started by calling a bunch of mattress companies and furniture stores in the Madison area and just explaining the situation and seeing if anybody was able to donate a mattress, and hit a lot of dead ends. But after hitting those dead ends, one furniture store, A1 Furniture, came through and donated a mattress completely free of charge.
When I met the guy and they told me about us, first of all, I just tried hiding my my face or something like that, because I say, the guy's doing like that. They say, anything you need to help. I know you have a story, I know that. They give you the mattress free.
The main thing that this family has taught me is just by listening to somebody and not interrupting them and really caring about what they're saying, that makes all the difference, and you can learn so much from somebody just by being quiet sometimes.
We've honed the skill of being able to actively listen to what they want, and I think in my law career, having a client come to your office and you being able to sit down and listen beyond what the actual words are telling you, but understand their story just by listening, can help you be more effective advocate and litigant.
Working at the Center for Patient Partnerships has really, it's solidified things for me. So I've always wanted to put the patient first and always wanted to be an advocate for my patient as a physician, but I think that I've learned listening skills and also really seeing the challenges that patients face from their perspective while they're going through the healthcare system. And I feel like it's a really unique perspective that not a lot of other physicians in training get.
They never say no, partnership. They never say no. They no guarantee 100%, but they no say no. They say we go together and watch what can do it. But they never say no.
This will be such a valuable lesson for myself to use with my patients in the future, but also for me to bring back to other medical students, that they can be advocates for their patients as well.
If our group is selected to take part in the BMO Harris Cheer Challenge, we will use the prize money to further our educational mission and provide scholarships for students to study at the center. If there's anything we know how to do at the center, it is to work with passion. We also like to have fun, so the passion and the fun mixed together creates a pretty potent combination. If we are selected, we will not only be there on race day, but we'll be wearing matching shirts that we've already designed and ordered. We'll be there with cheers, loud noisemakers, signs, costumes, and props to make this year's Madison Mini-Marathon a raving success. If you would like more information, you can reach us at patientpartnerships.org by searching for us on Facebook, CPP Advocacy, or following us on Twitter at CPP Advocacy.